You're saying it's not passable?
You know what?
Yeah, well, AP, we did, but I ran into
I don't know how to rotate it.
I don't
They
either.
really tear it up.
I think you can rotate it, but
Well, wouldn't you think?
I know. If you go like this.
It's running, Jeff?
Yes. Yeah, that's, I have that
Okay,
too.
there we go. Here we go.
All right. We will call the Cook County Public Health and Human Services Board to order at 8:30 on June 19th. And we have one addition before the approval of the consent agenda, and Allison is going to present a new staff member for us.
Yes, so this morning we're happy to welcome James Zimmer. He started just last Monday, June 11th, and he is filling the role of adult mental health case manager. Grace, I don't know if you have anything else you'd like to say about James.
James will say a few things about himself,
Sure,
but
okay.
I can't tell you how pleased we are to have a full team again. It's
Yeah.
just very, very nice for all of us. So we're really, really grateful that James comes to us with not only knowledge of the community, but also educationally, and his previous work is a great asset to our community. So I'm just going to let James say a few things about himself, if that's okay.
First of all, I'm honored to be here. Thank you for letting me sit here. About 14 years ago, I actually appeared before you guys. I actually got the my certificate of appreciation from you guys for my my first trip into Iraq. So I still remember that, and thank you so much for presenting that to me. I come here with 20 years of military experience. I did a little bit of mental health while I was in the military. I just retired out of the military, so yes, I left home for 20 years, and I was more than happy to come back, and to be able to come back and serve this community is a dream of mine. So thank you so much.
Thank you for coming back.
Thank you.
Thank you.
All right. And next we have the approval of the consent agenda. Would anyone like to pull anything from the consent agenda? Would anyone like to make a motion to approve?
So move.
Oop,
So
second.
we'll do Ginny and then Myron. All in favor?
Aye.
Okay. Everyone's favorite year-end financials. All right, Lori, you're up.
Morning.
Morning.
Try to make this not painful. As you know from the last presentation, I'd rather just keep things short and sweet and just try to give things, there's a lot of data, there's a lot of numbers, and just give it some context. What does it all mean? So I sent everybody a copy of the consolidated financial report, and just very briefly, the overall revenue for 2017 came in just slightly under budget. We received about 99.5% of what was budgeted to come in. Key differences in the expected revenue was an area called charges for service, and that area was low. It was only 71% of what was budgeted. Charges for service is the amount that can be charged back to the state or potential health insurers for some reimbursements of services that we provide to clients, like outpatient chemical dependency treatment or mental health targeted case management that our caseworkers do, and adult services care coordination. This area makes up just about 4% of the revenue. It's a small portion of the revenue, but our ongoing goal is to see if we can pursue more in this area of the source of funding. 2017 medical assistance recovery revenue was higher than budgeted. These recoveries represent the federal and state law that requires the DHS and local agencies to recover costs that the MA program pays for its members. In 2016, our department also recognized a significant increase of revenue in this area. It should be noted, however, that these recoveries need to be returned to the Fed and to DHS. Our county is allowed to keep only a portion of what is collected. The appropriate 75% of the recoveries that were collected in 2016 and 2017 are actually being returned back to DHS this week. So even though it showed that we had this area as a higher area of revenue, it's not our money to keep. We collect the money we're allowed to keep. like an incentive for collecting the money. But the 75% of the portion of what we collected in 2016 and 17 really belongs to DHS, and they'll allocate that back to the Fed. Overall expenditures last year were about 10% less than what was budgeted. In our three areas, income maintenance had expenses that were slightly higher than the budget. Program costs and supplies, particularly in the area of provider transportation costs, made up most of this increase, and I'll explain a little bit later what this means. And we are looking for ways to recoup some of those expenses. Social service expenditures were significantly less than budget. They were made up about 76% of what was budgeted. Most of the savings recognized in that area were from fewer out-of-home placements during the year and chemical dependency case management due to staff shortage. Public health also came in less than budgeted at 90.7%, and that's mostly due to a continued staff vacancy in that area. The difference between total revenue and the unexpected savings and expenses allowed for a return to the fund balance. And so I'll just put a little, put a few slides together, probably like pie, because we can do it tomorrow. So this shows where the money comes from that funds our department. Money from state and federal funding makes up 39% of our costs. Charges for services such as reimbursements from the health insurance plans, miscellaneous revenue, such as funds that are recouped from state recoveries or parental fees, that adds in another 9%. A very small amount of our revenue comes from the liquor, beer, and wine license fees, and the remainder comes from county taxes. What do we do with all that money? We have three main areas of responsibility. Starting with the blue area there, income maintenance, that makes up 20% of the money that we get in. Social services uses up 53% of the money, and public health uses up 27%. We'll start with income maintenance and see where we spend our money there. In the area of income maintenance, our staff administer Minnesota healthcare programs, such as MA and Medicare savings programs. We also administer financial assistance programs, SNAP, food support, cash assistance, and emergency assistance. This graph shows where funding comes from to pay for the staffing costs to administer these programs. So you can see federal administrative aid is 46%. We get a little bit of money for medical assistance incentive from the state and Fed. You'll see the recoveries there for food support and for MA. And county tax makes up 47%. This is for the staff cost to administer the programs. This graph shows the areas where the financial assistance expenditures fall. You can see we'll start again in the blue at the top there and work clockwise. Food support makes up 5% of the expenditures. County paid burials 3%. County share of nursing home 9%. Healthcare access is a large portion. Provider transportation and cost-effective insurance and Medicare Part B. We are reimbursed by the state and Fed for the county share of nursing home, healthcare access, cost-effective insurance, Medicare Part B, and food support. County dollars then pay for the provider transportation. That's the in-home support providers that are transporting clients to appointments, that type of thing. And county paid burials is also something that's not reimbursed. Provider transportation does seem a little high as we're looking at it. That's something that we are going to be looking at to see if we can find some additional funding sources for that program. Also, under income maintenance, we provide child support services to the community via a contract with Carleton County. This graph shows the funding sources that are received in order to provide the child support services. Federal and state funding, along with a small amount of fees, make up about 68% of the revenue that's used to operate the child support services, and then the remainder would then come from county. services, which makes up 53% of our money. This graph shows a proportional cost of providing non-contracted programs, ones that we actually provide with our staff in-house. Children and family, that is child welfare, child protective services, parent support outreach, adoption or guardianship services, and child caddy, the community access for disability inclusion. That's the child portion. It makes up 35% of our cost. A small portion goes to child care licensing program. An even smaller portion goes to the chemical dependency program. Mental health, including adult and children development, mental health area includes adult and children's mental health. That makes up 19%. Developmental disabilities, again, that's also adult and children, 6%. And then the largest proportion is the adult services of 37%. That includes adult protective services and also the adult caddy, the community access for disability inclusion. This shows the staff hours that were spent in children's services. And you can see that it's almost doubled in the last 4 years. 2013, we spent over 1,700 hours in the course of the year. In 2017, almost 3,500 hours. Again, this area covers child welfare, child protective services, parent support outreach, adoption or guardianship, and child portion of community access for disability inclusion. Children's out-of-home placement is also under the social services area. This is the number of clients that have been served in children's out-of-home placement. You can see in the last 5 years, from 2013 to 2017, it's gone from 14 in 2013 down to 10 that were served in 2014, up to 25 people that were served in 2017.
Lori, Myron's got a question.
Well, I think I was going to go to this question about a home placement. What is the cost of that, or is that the next slide? 41,653. Correct?
That's all of these. This is all.
So it's, what is the total?
Placements in 2017.
Oh, that's a revenue, excuse me.
230,247.
Which is down.
It is.
That's really low.
I'm gonna go into that as well.
Yeah, that's really low, and I may would comment on this later, but I know that the YMCA, through its child care and some of our programming that we're dealing with this pre-teen age group, we're having after-school programming for them. And hopefully that's gonna help, but, you know, in St. Louis County, it's 20 million a year, which is very large, and Itasca County, larger again, it's 10 million. So I think whatever we can do with interventions, whether it's the Y or anything else, is gonna be to our benefit in the future. I'm sure that'll come up again, but I really also want to commend our department and, you know, and the community, because we're way down on the bottom on this one. Amongst the whole district of northern and northeast counties.
We've got,
But by any measure, I mean by per capita or whatever, it's, so our community's doing well, and the department's doing well.
I was kind of wondering if our supports of permanency are part of why. Because we're higher in that, and is it the work that we do there that's reducing the out-of-home placement, or two different things? Okay.
We can look into that.
Rephrase that again, Commissioner?
Our supports for permanency, which is what we do ahead of out-of-home placement.
Yeah, okay, yeah,
that is
intervention, okay.
up significantly.
And what things are included in that?
I think that's a bigger discussion for
Okay,
I'm
later
not
meeting.
certain, but we can look into it and let you know.
okay.
Yeah.
Well, it's going well, but I would like to know more about that, because I think also, you know, this restorative justice issue is also designed to keep out-of-home placement costs down. And so I think this is gonna be part of that discussion coming up that I'll be involved in July 10th. Yeah, thank you.
All right.
As you can see with the way the number of placements drastically changes from year to year, this area is almost impossible to budget. There's a lot of conversation that takes place with the children's services staff to attempt to predict what our need might possibly be. Staff will look back at placement history to try to predict the following year, but as you can see, placement history is kind of all over the board. The types of costs for this area include shelter care, foster care, treatment or group home, or correctional. While the number of annual placements appears to be low, when you think of the size of our population, a placement of just one family could actually increase this by 20% in a year.
Depending on the length. So correctional placement, we have 0 again? We didn't have any in,
I think that's what you're hearing.
okay, we didn't have any in 16, and, I mean, that again goes to show the work that we're doing before.
I think in 2016, or I know when I was on NERC, I'd look at those statistics, and that's the juvenile center. Yeah, and it's interesting, because on that data, we had one, a young girl, and I was visiting it. But that was in 2017, yeah.
Thank you.
Another area of social services is the child care employment and training. And just to show where we get the funding for this, just to explain what it is. We administer state-funded child care and employment training subsidies. The employment training subsidies are services that are provided to participants in family cash programs. We contract with the AEOA for those services. This graph shows the funding sources that are used to administer the programs. And as you can see, 84% of that comes from the federal, 15% comes from the state, and a very small portion comes from licensing revenue for the child care providers that are licensed. Another area of social services is chemical dependency. We have contracted with Wilderness Outpatient, but we also provide some services from our staff. And you can see the staff hours was greatly reduced in 2017 for non-contracted chemical dependency services. This is due to staffing change in the adult CD case management. We had a vacancy for almost all of 2017 as well.
So how do those people get served?
That caseload was absorbed by the other staff. Grace, the supervisor, took on much of the chemical dependency case management work during that transition.
Wilderness Outpatient, he contracted services for chemical dependency treatment. This is where the funding stream comes for that. 15% of it comes from the liquor license fees. Client fees and insurance reimbursements is about 11%. And this seems low, and that's something Allison and I discussed yesterday. We'll be looking into that to see if there's more that we could be doing for recouping money back from insurance. Another area of social services is mental health services. We again had the vacancy in mental health area in 2017. We would expect the number of staff hours in 17 to have been higher than what they were. Social services also has developmental disabilities. The number of staff hours again seems low for 2017. There is a small caseload, and this is variable due to our population and community. Adult services, staffing hours, comparable to 2016. It is low, however, with turnover due to a long-term staff person who retired in 2017. that area to be higher as well. Next area is public health, which makes up 27% of our budgeted costs. The areas of public health, things that Joni does. Starting in the upper right with the blue there, infrastructure is attending state and regional meetings, doing administration, and the community health assessment. Promoting healthy communities and behavior, 53% of her time and costs are spent there. That's in the area of family home visiting program and collaboration work within the community. Infectious disease is a very small amount of time spent there. Preventing the spread of infectious disease, that's including TB screenings at the jail. Disaster preparedness, 10% of our costs go there. That is for preparing and responding to disasters and emergencies. Health services, 18%. Assuring quality access to health services, that's also work that's done in collaboration with the community partners. And as I said in the beginning, that we had some differences between the fund balance of what was spent between total revenue, and we had an unexpected savings in our expenses allowed to return to the fund balance. And when we're looking at this, this is something that Rafa had presented annually. On the right-hand side, you'll see the fund balance at the end of each year, going back to 2007. And 10 years ago, the fund balance was just over $1 million. At the end of 2016, that fund balance had gone down to $514,000. At the end of 2017, it's back up to $837,000. In the second column, you'll see the actual use of the fund balance. And when you're looking at this, the negative amounts that you see, think of that as being dipped into the fund balance, and positive amounts is what we're contributing back to it. And the next graph will explain that just a little bit more. I should note in 2017, the budgeted amount was for $0 use of the fund balance. In social services, out-of-home placement costs were significantly under budget. The staffing vacancy in chemical dependency case management, that also led to a savings of expenses there. Public health expenses for non-contracted services were less than budget, and we continue to have a staff vacancy in that area. This represented a replenishment to the fund balance of $323,000. And this is where I'm referring to the dipping into. If you look back in 2007 on the far left side of the screen here, you can see that it was dipped into the fund balance by over $250,000. The next year showed a contribution going back into it. 2012, 5 years ago, showed another big usage of the fund balance. And 2017, where you see the screen flowing back up, that is a significant return back into the balance.
Is that a result of unfulfilled positions partially?
Partially.
Okay. And what would account for the rest of it?
The prediction in the budget for out-of-home placements
Okay.
in 2017 was predicted to be higher than
Yep,
the
that's
costs that were
that
spent.
glip, or that dip, yeah, okay. Thank you. So if we fill positions, we would anticipate that that would go, you know, that contribution to the reserve could go down,
Correct, but the contribution.
and maybe should.
Could go down.
Our fund balance is still lower than we need it to be. We actually need to put more into our fund balance.
No, that's a good point, I don't know.
So,
This shows what the fund balance has looked like for the last 10 years. After 7 years of dipping down into it, the 2017 fund balance now shows a replenishment back in. And you can see the fund balance is coming back up. This is the actual balance.
While it's in my head, I guess, to pursue what Commissioner Dukirk mentioned is that maybe that's something when the budget committee, you're asking, and we take a look at that. And how do we account for that, and
budget
what would
correctly
it
for the
do?
departments and then budget to add in instead of budgeting for zero. But I mean, I don't know if we're there yet.
Well, it could be a long-term, yeah, it's worthy of discussion, so thank you.
Commissioners, we do have a fund balance policy, which Brady will review, I'm sure, at one of our upcoming meetings. We have a fund balance policy of
That's
trying to
right,
maintain 75% of our general fund, operating fund as a fund balance, and an overall fund balance of 50% of our annual funds, so that takes all of them together.
And we're at 72 now?
I could not report to you on what we're at right today, but
I think we are.
But there's two different numbers there, 75% of the
But-
general fund balance and 50% of the total operating funds.
And that would be applicable to social services as well?
Social services and highway department are the two special funds other
Okay,
than general.
thank you, yeah, that's,
And we've
Maybe
been
we should
really
discuss
close
that.
to 50. We've been under, yeah. I mean, our general one we've tried to keep, but we've not focused on these other ones, which I know you've been here for a short time, but I know you feel the stress of where we're at with that. Yeah, if we hit another recession, I mean, it's great that in 8 and 9 and 10, we were able to compensate with the recession that we had and not to add a burden to the taxpayers. But we're not in a recession anymore, I don't think. Go ahead, Myron.
so pursuing this in the moment at this time, just to maybe address it later, is that we could look at transferring from our general fund balance to the social services?
No.
We can't, okay. Well, so,
Commissioner, we can, this is
yep.
not the
The
place to have
discussion,
that conversation.
okay.
The conversation, that would be at the budget committee with Brady, and it wouldn't be a common practice.
No, all right, thank you.
And we're low on that one also. I mean, if we had 100% in there, it'd be a different conversation, but. Jenny?
Lori, the last 3 PowerPoints I don't have in my packet. For me, I don't know if anybody else wants it, but could I have a copy of those? Okay. Thank you.
Anyone else have questions for Lori? I guess that means you covered everything.
Great.
So you're off the hook. Were you nervous? Good. Got it all covered. Thank you. All right, director's report.
Start by saying thank you, Lori, for that excellent presentation. Let me remind everyone that Lori is still very new in her position, and all of this budget data is from last year when she wasn't an employee, so I'm really impressed with the work that she put into this presentation, so thank you, Lori. Start out with some staff updates. In the fiscal unit, we have Plamen Dimitrov, who was approved at the last regular board meeting to join our department as a fiscal officer. He starts July 2nd part-time and then full-time on July 16th. Plamen will be filling the vacancy that was created when Lori was hired as the fiscal supervisor. So we're really looking forward to having that unit fully staffed again. James Zimmer, who you met this morning, began on June 11th, as I said, as the adult mental health case manager. So again, that will be a great relief for those other units in adult services, children's services, who absorbed that caseload when that position was vacant long-term. We are currently working to fill the adult services case manager position. This is the social worker, full-time social worker position that will be vacated when Beth Ferrone retires at the end of September. So we're continuing to recruit for that position. Again, the long time frame there is both to ensure that this individual has time for cross-training with Beth, and we just anticipate this being a harder position to fill because it requires either a bachelor's or master's in social work with the ability to become licensed or licensure as a social worker. A few updates from the agency. Summer is audit season for whatever reason, so our staff and supervisors are busy preparing and responding to audits really across the agency. Adult Services has 2 major audits, and then the Wilderness Outpatient Treatment Program, the Chemical Dependency Program, also has an audit coming up. And audits are a time for both the Department of Human Services and for some of the health plans that we contract with to review programs, policies, and case files, and just ensure that we're in compliance. We're continuing to meet with Sawtooth Mountain Clinic to discuss the potential of transitioning our family home visiting program to the clinic. We are starting to have more detailed conversations about the program, including potential reimbursement rates, equipment, training requirements, all the complexities with electronic health records. And again, this is it's particularly complicated due to the fact that we're looking at transitioning a program, and we also have the long-term goal of fully implementing the best practice family home visiting program, Family Connects. We hadn't been able to do that because that program requires 2 nursing staff. And again, that's one of the assets that we see in potentially transitioning this program, is that the clinic would have more nursing capacity to meet those requirements of having 2 nursing staff, and really the cohesion with the other services they're providing to families, prenatal, and the WIC program. So again, it's a lot of detail to work out to help Sawtooth Mountain Clinic leadership and board to make a decision about taking on that program. The Community Health Assessment Stakeholder Group met Friday, June 8th to look at additional data within those identified priority areas. As a reminder for you all, those areas that were identified through this process include healthy living access, things like living wage jobs, food and housing, medical access. So again, beyond just access to traditional medical services, those social determinants of health that can really impact individual and community well-being. Financial and social inequity, mental health and substance abuse, and services for elders were among the other priority issues. And we anticipate meeting again probably in July. We've been meeting every other month with that group. On the off month with the Public Health and Human Services Advisory Committee, because that stakeholder group includes most of the advisory committee as well as some other community partners. The last update I wanted to share with you is just an example of something that we're doing as a department to increase program access to preventative services. Again, this is exciting because it's a really small investment to have a potential big impact on individuals and families, but our income maintenance supervisor, Allison Plummer, found that just 10% of eligible residents in Cook County, MA eligible residents, were utilizing the Healthcare Access Program. That program allows reimbursement for certain medical expenses when someone who is enrolled in medical assistance or a prepaid medical assistance health plan has to travel for medical reasons, and that could be in county or out of county. And again, just 10% of the population was utilizing that services. And Healthcare Access, as you saw in the presentation from Lori, it's a program that we receive reimbursement from the state. So everything that we're paying out to clients to reimburse them for their travel, we are able to then bill the state for that amount. And again, we're working with the agency financial workers and Sawtooth Mountain Clinic as well to do some targeted outreach to pregnant women. Women who are enrolled in medical assistance are often contacting our agency to report that change because it could impact their eligibility. So at the point that they're contacting us, our plan is to then send out a notice explaining that this program is available. And then again, we're working with the clinic, Teresa, who's meeting with pregnant women, to ensure that she's also providing that information and referral to these families. We're also referring them to additional programs like WIC that they might qualify for.
Awesome. Is that your whole update?
That's my whole
Are
update.
we going to talk about scheduling? Next month's meeting?
Do you want to?
August, or do you want, it's the August meeting, not the July meeting, so.
Okay. Do we want to wait till next month?
Yeah.
No items for board action. Committee reports. Myron, Arrowhead Economic Opportunity.
We're having a meeting tomorrow, and I plan to go to that. We're going to the curling club. There is an expo tomorrow morning from 9 to noon, which is for the area, showing the services that they provide, we provide, and very extensive. And it's, I haven't been able to attend that before, so I look forward to that and knowing a little bit more about the services. But it's a very comprehensive programming that goes on there. It's quite, and a lot of it is service here as well in the community. Most notably, Arrowhead Transit is part of that. That's about it. I won't know until tomorrow. We got a very lengthy agenda. I know that.
Yeah, thank you. Arrowhead Health Alliance, Jan.
Thank you, Madam Chair. It was a good meeting, and I know Allison, you attended my video for most of it, and it's really interesting because there seems to be a lot more conversation now since we have 3 new directors, Public Health and Human Services directors serving on that committee. The conversation is more lively and more future-oriented, and it seems like the solving of the issues seems to be more, there's a lot more conversation. It's a great group of people. They're very talented, bring a lot of expertise to the table, and they're a very compassionate group. So kind of led by Grandpa David Lee, who's not a grandpa, but, he's just the person who's been in that position the longest. So we've got a lot of new public health and human service directors that are adding a lot of vitality. But David Lee's experience gives it that perspective and context. So anyway, the things are moving along. I just had a couple of things I wanted to mention. August 27th will be Mental Health Day at the fair, at the State Fair. So there will be Arrowhead Health Alliance staff staffing a booth all day. There are 10 hours of programming, or there will be 10 hours of programming planned all around mental health. The governor will make a proclamation. There will be a demo of the telepresence. Probably one post will be at the fair, and then maybe a jail or something to show people how telepresence works. I don't know how that will be received in the fair context, but it's worth a try, because I think that's where a lot of the work has been done, is in the telepresence aspect, and it certainly affects remote places like this. It's been a huge help, and the telepresence, the people that are engaging in it or have it has exponentially exploded. In fact, they made some projections like 3 years ago, and we just barely exceeded them. So, and their projections were pretty extreme, and so that we've exceeded them is kind of interesting, that people are really getting on the train of connecting via telepresence. In April, Charlie Parr had a concert that was sponsored by, I think, the Region Mental Health Initiative and AHA, and it was a sold-out concert. I guess it was very well attended. It happened at the North Shore Theater, which is a new venue, so it's hard to say what people wanted to see more. But I think it was. It sounds like it was a great concert, and I think they're looking forward to maybe trying to do it again next year. Same venue, but different artist. Although I think Charlie Parr's addition to the message is really profound and very deeply appreciated by most folks. Birch Tree and Wellstone had a little higher than expected occupancy in April and May. The expected occupancy is about 50%, and I think Birch Tree was about 58, and Wellstone was a little over 60. The 50% occupancy evidently is a good thing for many reasons. It provides room for people in emergencies, so you don't want 100% occupancy. If it's 100% occupancy, that means people are being turned away. The group is working really hard to get good data so that we can make improvements and measure our effectiveness and make sure that people aren't being turned away for the wrong reasons. So we're getting better and better at what are those questions that we need to ask. What is the data that we need? So we're trying to understand the need, the effectiveness of our service, understand the missing pieces, and how we can improve. And sort of a next step in the bigger regional conversation, Senator Sencham was able to get money for the region for mental health hubs or centers. And so the conversation, Clarity Project conversation in St. Louis County continues to move forward with some intensity. And so about $5 million has been earmarked for St. Louis County for this project, or for this kind of work. And some, Commissioner Boyle from St. Louis County commented on how one major development has happened with Essentia and St. Luke's being on board, and they have both brought their billing people to the table, which really helps the understanding of the whole group and how you get funding back for this programming. So the conversation is really about how you can synergize the money. So how you can get more money back from insurance companies. So how do you model these programs to get more money, I guess, or feed more money back into the system, which is from the private sector, of course, and which leads to some pretty interesting conversation. But it's a medical-based model, which is why the two major hospitals, regional hospitals, are really important to have at the table. And they have the most to gain because they figure they can save about $40 million a year if they can get people out of the emergency room and into a safer place and a more appropriate place faster. So they're at the table with some real energy and enthusiasm, because that's a lot of stake that they personally have. And then the county's role, of course, is, what happens after the medical piece is done. So the county piece at the table is, how is that warm handoff from the medical come to the county part, which is complicated. And anyway, I'm having a hard time even understanding it as I explain it. So the Clarity Project is this triage out of the emergency room project, creating a mental health crisis center or hub. And one of the things that is being talked about now, because there is some space behind the Birch Tree Center, that there's a possibility of building some long-term housing that would be longer term than Birch Tree. I think it's a 3-day or 4-day. Is it a 5-day? I can't remember the exact details, but and not only that, but it would be, they're trying to think of it in terms of what's close in proximity, so there aren't these huge transportation issues. So evidently it's located close to the Center for Drugs and Alcohol, and Center City Housing is at the table talking about that. Center City Housing owns Birch Tree Center, and AHA leases from them, and One Roof Housing is at the table trying to think of ways to create housing, this long-term housing, which is really exciting. Although they're talking about only 20 beds at this point. But all in all, this led to really interesting conversation about how we're being driven by how the insurance companies bill. Sort of like our whole conversation is about how we can get more money from the private sector to, by saving them a lot of money. So it makes sense, but that billing piece would become a critical piece in the conversation, rather than how do we serve people better and then create the funding for that. It's the paradigm that we're in, and how do we shift that paradigm, I think, is where the conversation is going. But all the people at the table really want to talk about that, so it's pretty interesting. It's a very interesting time, I think. So that's it.
Was it very hopeful that the paradigm could be shifted?
Yeah, I think so, although I think it's hopeful that the paradigm is even realized. That we're, trying to work at. We're coming at it from sort of a vulnerable victim angle, rather than taking control of the but it is I think fairly positive. This is, like I say, these are new public health human services directors, so I think there is hope there, and I think David Lee is a real hopeful force in the conversation. He has so much experience, and I mean he is
He's gonna be really glad you called him Grandpa.
in this group.
Who is David Lee?
David Lee is the Public Health Human Services Director for Carleton County.
Carl, okay.
And
I
St.
thought
Louis
it-
County got him for like a month or 2 months, and he went back to Carleton County.
That was interesting.
Yeah,
Yeah, I was thinking I know him, I met him someplace.
yeah, he's a great guy, great force to have on this team of, of mental health. Yeah, establishing mental health. So that's
it? Yep. Arrowhead Regional Corrections, Bobby.
Well, we went over our usual numbers, and then they brought out a thing for our cost share this year, and it's basically the same. I don't think it's gonna go up. And
Even
then,
after the roofing project?
yeah. And then, I don't know if anyone goes on YouTube, if you pull up Good Citizen of the North, this is that guy they told us about at our district meeting going into government buildings. And,
yeah,
and so he was at NERC,
good citizen of the North.
asked to leave.
What a title.
Came back, got arrested. He was in the Commissioner Nelson's office in Virginia. So,
Oh. So maybe he'll come visit us?
so maybe he'll be up here after he goes to court. But
Cool.
other than that, it was a very short meeting.
Amazingly. Thank you.
But if you YouTube it, it has it all on there, so.
What's the title for the
Good.
YouTube?
Good citizen of the North? What
Yeah.
is it?
Find it here.
He wants to be arrested.
Yeah.
Yeah.
Oh, yeah, lots of stories.
Yeah, GCOTN, Good Citizen of the North. Thanks, Bobby. We'll have something to do this afternoon.
He has several videos.
That's good. All right, Community Health Board is not a short meeting. It's a long meeting, and we do talk about mental health during that meeting, and we, some of the conversation was the number of deaths that come up and what those are related to, and I did get information back from Kimber, and they don't keep track of that data for us, but the other counties were talking about in their hospitals, the numbers of deaths related to mental health, chemical dependency, and suicide. And they're seeing those numbers go up. So, I don't know if it's fortunate or unfortunate. We live in a small town, so when there's a suicide, we all know about it. And, I think the group was kind of shocked when I said we actually have people who come to Cook County to commit suicide rather than some of our own. So Kimber didn't have the number. She said the statistics were on the Department of Health, and those statistics are lagging. They do them in 5-year increments, so I don't know if we can get other information. And then a lot of the other stuff we do is just signing contracts and updating and lots of different things. But we're very grateful that that meeting is the entire region and we can do it upstairs. That's a very nice thing to do since it's very long. But Bobby drove 6 hours for a 45-minute meeting, so I don't know what's
Wally
better.
ran the meeting, so.
I don't know what's better. But Public Health and Human Services Advisory, Jerry and Carla.
Well, we did not meet this month, so.
Wow.
Next month.
You're gonna have a very long meeting next month. Healthcare Planning, Ginny.
Well, we had a short meeting. We didn't have a lot of attendees, but we had an updating from the Violence Prevention Center, and they've hired Carly Puck, and she's going to be going into the school to work with various groups there for 6 months, and I was impressed with the program, so I invited her to come down to Birch Grove and do a presentation down there when we had lunch, so that was well taken, and that's about it.
Thank you. North Shore Collaborative, Jan.
Thank you, Madam Chair. Now, this is a group that I always question the amount of time that we spend in meetings, and people come from St. Louis County, Cook County. We either meet at Bluefin or we meet at Beaver Bay, but we're taking taking advantage of video, and so I think every other meeting will be meeting via video, which really helps that travel part. A lot of people come to that table. There's not a lot of money that gets spent, so a lot of energy around a very tiny little pot of money. So I always wonder about the value of that. There's got to be a better way more efficient way to do that work. However, all those people come together and they share they share what's going on in their departments or their counties, and so that's valuable. But I'm not sure if that could just be shared somehow. I mean, we're all doing that when we go out and about. But I question that. Allison, this was your first live meeting. Had you attended via video before?
This was the first chance that I've been able to attend this meeting. I've had
Yeah.
a conflict it's every other month, and I've had a conflict each time. But the North Shore Collaborative is a group of directors, commissioners, mental health providers, people from the schools as well, talking about early childhood services. And one of their biggest projects, I guess you could say, is the LOTS program, Learning Opportunities Together Through Stories. So they fund that program. And what's great about LOTS is that it's really across the county. They offer programming in Grand Marais and Grand Portage and in the West End. So it's really great that the group can
Yeah.
promote that.
And they buy books for kids, so about $3,000 they spend on books every year. And there's a Grand Portage community dinner and lots meeting or gathering. And I'm not sure what I've sort of forgotten what happens in Grand Marais. It's changed a lot what happens in Grand Marais, but the Birch Grove centering around the pizza oven, it's like centering reading around food seems to make sense because it's usually at the time of the day when people are hungry and you can't take in learning if you're hungry. But it's kind of a nice community event. But that's just a teeny little budget, $5,000 a year, and it's like all those people come to the table. And then the other thing that we do though is do the mini grants, but they're mini, and we usually send kids who can't afford it to like Wolf Ridge or things like that. There's we just awarded a grant to a group in Two Harbors, the Rock and Roll Group, and they get they gather kids who are enthusiastic about music, and they try to get them instruments, and it seems to be a great extracurricular activity for kids who wouldn't otherwise have that opportunity. So it's a nice volunteer effort. So there are lots of these little small, mini little things, and we gather every other month, and it's a two-hour meeting. And but I think it's more effective that we won't be traveling if we kind of cut that down. I think it used to be a way more, well, they used to have a bigger budget, and that budget has shrunk. So, and the money comes from, and you might have a better understanding of how the money comes through the study,
The local collaborative time study, so
Yes.
that's related to public health hours and reporting and revenue that we get back from certain activities.
yeah. So anyway, it's another complex layer of county work that we participate in on a daily basis as commissioners.
Thanks, Jan. Emergency preparedness, Jeannie and Byron.
Want to start?
Well, we met last month, and we're going to have a program the end of this month where we have some homework to do. We need to go online and and study different preparedness levels, and so I guess we'll need to have our homework done before we meet again, right, Myron?
Are you gonna
Well,
do
I've
your
done it.
IC?
The 100, the 700, yeah.
Awesome.
I did the 700 yesterday. It takes 3 hours to go through this thing.
Oh, my goodness.
And I had a block of 3 hours, and I had another meeting at 7 o'clock last night, so I made a mistake. I did it all at once. And I didn't stop the study, and I didn't pass the test the first time. I think I missed a couple, and I haven't had a chance because I had to get to this other meeting and eat. So my advice is haste makes waste, because I thought, oh, shoot, I can breeze through this, and
Okay.
I got tricked on a couple of questions, and I think I know which ones they are, so I'm gonna have to review and take it again. I think that's the first test I've ever failed. But I'm, 74 years old, and I know my brain is not as sharp as it used to be. But so, I caution you to maybe,
easy. Okay.
don't go so fast.
Well, maybe if you start at 100, it isn't so bad.
Yeah, I've done that one, yeah, so.
That's great, because we're required to have one commissioner that's gone through this,
Yeah.
and I was the lonely commissioner
Yeah.
for a long time, so I'm really excited that you two are doing it.
Yeah, it's
Okay.
worthwhile. NIMS is the one national, you know, and there's just a lot of titles and things that it's getting a common language and common guidelines, and so. Haste makes waste, and I'm not as smart as I used to be, which everyone knows, so.
Well, it's interesting, when I would join the fire department, and then, you know, a year later, we're at a meeting or whatever, talking about this certification, and I'm like, oh, I have it, and the former assistant fire chief goes, oh, we all knew that when you offered to volunteer, because you need it on the fire departments too, and I'm like, wow.
It's very worthwhile, and I
It
have to go, but I don't know when I'll have time, not till next week, but I think we have to have it done by
The next
Tuesday or
meeting?
something, next meeting, because then we're gonna go through the 200 together.
That's great,
Yep.
awesome. Anything else? Well, before I forget, I would just like to thank Allison and Lori and your staff for the work that you do, because it's not just the work you do, it's how you enter into your computers the work that you do, and which slot you put it in, and how you calculate it, and how you fund it, and how you get it back, and how you put it on a piece of paper so all these commissioners understand it, and it's not an easy thing to do, so, Yafa, if you're listening, I'm sure you're watching, thank you. To see the fund balance going up instead of down is, I know it's circumstance, but it's also a lot of planning to hope that we can do that, so thank you. And with that, can I get a motion to adjourn?
So moved.
Second.
All in favor?
Aye.
Thank you.
Thank you, Commissioner Dukert. Good job. Yeah, geez, that was frustrating. Then I talked to someone that spent 17 hours.
Get some.
Are you available?
I'll have to find my paper on how to.
I had sent an email last night about,
Yeah, I had a little trouble with it. Yeah, well, it's on that
originally Steve Nielsen.
and then
Well-
it's got slash.
I know, I'll have to add them in the cancel.
Yeah,
Here's the map. So we've got,
it's, I mean, it's almost 3 hours to get through it.
She's
And
coming.
At the end of the day, you know, I would do it in the
So
morning.
you
but
can
I mean-
review it.
And I rarely have 3 hours.
I just
they
didn't
get your
have time
name,
to
so-
read it, but.
Yeah, well,
I
yeah,
saw
they
that.
sent me a thing and they said, send it to this mail.